Hi guys, I'm Dr. Shilpa Parikh here at Vitality Chiropractic and Wellness in St. Paul and Prior Lake. Thank you so much for joining us on our YouTube channel. We are trying to reach out to those of you that we are unable to help when you call to book an appointment, or those of you that want to take more of a proactive role in your health. We realize that sometimes it can be frustrating when you're trying to figure out why you're having certain ailments and you're going to see different providers and nobody is able to help you, and you kind of want to get to the bottom of it on your own. We encourage and empower you to do that, and that's why we've created these videos. So let's get started. Part 1 of this series is to talk about headaches. We see headaches quite a bit, especially as chiropractors. One of the first questions I typically ask patients when they come in and they're being treated for headaches is when their last eye exam was. It probably sounds like something so simple and so easy and maybe even unrelated, but the truth is sometimes when our eyes are having trouble focusing images, our neck muscles have to work really hard to help present that image to us and to our brain. So if you haven't had an eye exam, something so basic, but you've been getting headaches, it might be worthwhile to check out. The other thing I do want to mention is sometimes with the lenses, if you wear glasses, with the lenses themselves, if your eyes aren't able to adjust to polycarbonate, you may need to switch to a plastic lens. The other thing is if you're going back and forth from contact lenses to glasses, that can sometimes cause headaches too. And then of course, if there is a prescription change or difference between the two, that can cause an issue as well. The other thing you want to consider, and I highly recommend that you do this, is taking a look at your medicine cabinet. Are you currently on any medications? Are you taking any medicines that list headaches as a potential side effect? The other thing is dehydration. Sometimes medication can cause significant dehydration, which can make your muscles tight and obviously trigger a headache as well. Just along with medications, hormonal birth control. I see a lot of young girls on hormonal birth control, and one of the side effects of that is headaches, especially menstrual migraines. I'll have a video on menstrual migraines coming up shortly here. The other thing to consider with headaches too is your stress levels. Sometimes if we're in a state of sympathetic stress, kind of that fight or flight response, we use up a lot of B vitamins in our body. B vitamins are responsible for helping us rest and just kind of maintaining the integrity of our blood vessels and our brain. And so sometimes if we're really stressed, we've all heard of cortisol, we accumulate cortisol that depletes vitamin B, and what happens? We end up with a headache. The other thing you would want to consider is possibly looking at blood sugar imbalances. So if you notice around 2 or 3 o'clock, you're just feeling really tired, or you get hangry, and then eventually you get a headache, you might want to be checked for diabetes. That's not saying that you have diabetes, but sometimes if your blood sugar is out of balance, you can get headaches too. Apart from that, not sleeping well, of course you can get a headache from that. You're just not resting, you're not allowing your body to relax. The other changes that could be contributing to headaches too are small, simple ones. Sometimes I'll see gals coming in with their purses, and we like our purses, let's be honest. But if we carry them on a particular shoulder, we can have headaches associated with that just because the amount of pressure that's on those muscles. Some other things, sometimes candles, perfumes, they can be really fragrant, really strong, too much for our body to handle, so we end up with a headache. So lots of practical reasons why we could be getting headaches. It doesn't mean that you have a tumor, it doesn't mean that you have cancer, it doesn't mean that you have surgery necessarily. You definitely want to rule out the most common reasons why. If you have any questions, feel free to reach out. Our email address is below. Apart from that, we thank you for joining our channel and hope that you guys have a wonderful day. Stay healthy, stay happy, stay safe. Thank you.